Okay, three, two. Okay, and guys, we're rolling.
Hi, everyone. This is Dr. Ashwini from the Holistic GP podcast. Today, we are speaking to Dr. Mitchell Yass. He's the creator of the Yass method for diagnosing and treating chronic pain. So, he's developed this method over 20 years by treating patients over 20 years and helping them resolve their pain and returning them to full functional capacity. And he has stopped thousands from getting surgeries and dealing with unresolved pain. And for someone who struggled with pain, getting rid of their pain is definitely remarkable. And he says the key to his method is using the symptoms that the body presents with simple practical tests, which allows the correct tissue that's creating the pain or other symptoms to be identified. Now, this is very interesting for me as a GP to learn. So let's welcome Dr. Yes to our show today.
Thank you for having me. It's wonderful to be here.
Thanks, Dr. Yes. So before we get started, I did a bit of intro on what you do. So can you just tell us about yourself and what made you get into this field of work?
So, originally, my first career was a project manager in construction. I did that for 5 years, and it just didn't seem to work out. It wasn't fulfilling. I ended up doing what a lot of people end up doing is just working for money, and it just wasn't satisfying. So, I decided I was going to go for a second career. And the few years prior to this, I had had some self esteem issues. I was a very thin guy, and I wanted to put on weight. So, I decided I was going to lift weights, and I had basically taken a high school physics course. I didn't go to Joe Weider or Arnold Schwarzenegger. I went to those of physics and started applying physics laws to understand how to cause muscles to respond to resistance appropriately, and I was able to put on 40 pounds of muscle. So I got very interested in the body, and my parents had mentioned that some of their friends' children had become physical therapists. So I looked into that.
Mhm.
And it looked like something that would be great because I could work with the body and I didn't have to go on to the complete curriculum to become a physician. So that's what got me into it. And I kind of noticed very early on, when I was young, as a boy, my father taught me analytical thinking. I basically think purely logical. Everything is data in, data out. So my brain doesn't allow me to accept anything that's not logical.
Mhm.
And so, as I was learning the curriculum, I was sensing some of the things they were saying just really weren't making sense. There wasn't anything logical about it. It was basically just this is what you follow because that's what you're being taught and that's how you're going to practice. And that's all well and good until the first time when you're going to do your first affiliation and you have a person standing in front of you. Now, you have the responsibility. That person's in pain, they're having dysfunction. Now it's up to you to actually do something to change that. And I really don't understand why I seem to be one of very few people, if any, that would seem the most logical question to that individual standing there was to say, where's your pain? Point to where your pain is. And so they would point to where their pain is, and magically I would find that the location of their pain was not where if the diagnosed structural variation, like herniated disc, stenosis, or a meniscal tear, what to be in distress and eliciting pain. Well, if the pain isn't where the structure is that's supposedly causing pain, then the structure can't be the cause of the pain. It just works like that.
Mhm.
And so the best way to understand this is that let's say someone has pain around their kneecap,
Mhm.
right? Pain around
Yes.
the kneecap, they're diagnosed with a meniscal tear, a tear of the meniscus. Where does the meniscus lie? Between the thigh bone and the lower leg bone. So if that were to elicit pain, it has to elicit pain at the joint line, the point between the thigh bone and lower leg bone. Well, the kneecap is a separate joint, the joint between the kneecap and the thigh bone. So how would it be possible for a meniscus at one joint to cause pain at another joint? It's physically impossible. If you're willing to buy that, then you're willing to say arthritis at the elbow can cause pain at the ankle. Why not say that?
Mhm.
That's how
But they
perverse this
can be
got.
referred pain and they can be mechanical pain. Pain doesn't just resolve around that joint, right? Like when you say it for meniscus, it can be that they're overusing the other side, and that might be also causing the discomfort.
Well,
So,
if I'm talking about if you're going to say that a meniscus is causing pain, that the tissue in distress eliciting the symptom is the meniscus, then the pain can only come where the meniscus is.
Mm-hmm.
I'm not saying that, oh, if you have a meniscal tear, that can alter the mechanics of the joint. I'm saying that you're being told that the meniscus is the cause of your pain and you need surgery for your meniscus to make your pain go away. Well, that's not true because your pain's at the joint between you. Now, the question then becomes, is there something else that could be causing the pain around the kneecap? And the answer is yes. That joint is controlled by the thigh muscle called the quadricep, and it's either too strong or too weak or something's going on, and it's altering the forces being applied to the kneecap, which is causing it to alter its tracking. So you're getting pain due to misalignment of the joint surface due to a muscular cause. You're having pain at the joint due to a muscular cause.
Oh, got it. So definitely you're trying to get people to understand what's the true underlying issue and don't just presume that because you have a tear or arthritis, that's the cause
Right.
of your pain. And
Right. So you're getting
yeah, okay, yeah.
right. So the question, the scam of the system is pure and irrefutable. They're saying since a tear is found or arthritis is found at the time of your pain, I can simply assert that it's the cause of your pain. Who can deny that that is the core principle behind the use of the MRI? That's it. That's it. That's called correlative theory, junk science. That's saying if I open my front door when the sun rises, I could say opening my front door causes the sun to rise. That's the same exact theory. Okay, let me ask you this. That pain at your kneecap, is that going to be found if I do an MRI and it shows that you have two elbows? You do have two elbows, right? Two elbows are found at the time of the knee pain. Okay, two elbows is the cause of your knee pain. How is that different than saying the mere identification of a meniscal tear means it's the cause? It's exactly the same. It is lunacy. Lunacy.
So often people who go for this sort of corrective surgery, are they
Yes.
not finding benefit?
No. Not even close. By the way, let me just make one more point about this meniscal issue. What if you found out that a study showed that of those people who have knee pain, 63% are found to have a meniscal tear? 63. Of the people who don't have knee pain, 60% are found to have a meniscal. I thought meniscal tears cause pain. How could roughly the same amount of people who don't have pain have the same meniscal tear? That would be confusing. And that would lead you to say that as a degenerative and actually don't cause pain, and the people who are finding it when they have pain have another tissue in distress. So that relates to that. But going back to the surgeries, I've been doing this for 28 years. I've seen everybody from before surgery, and typically the person who gets the meniscal surgery, it fails in addressing that pain around the kneecap, shockingly. And where do they go next? They go back to the person and says, you know what the problem is? I also found a little arthritis. You need a knee replacement. Most people who get meniscal surgeries end up getting knee replacements after and still have the same pain.
Okay, so let's come to the solution. So what's the Yass method to
Sure.
diagnosing
So,
and dealing with the problem?
right. So let's go to the concept. You got to go old school, man. We got to go back to Hippocrates. We got to go back to the old style before technology led us into this abyss. And the answer, pain is an indication of a tissue in distress. I think everyone acknowledges that. It's a signal to let you know that it's not working. And the purpose of that signal is to create conscious awareness so you could get an intervention to resolve the distress of that tissue. And when the distress is resolved, the tissue doesn't have to elicit the symptom anymore. So the way to end the symptom is to treat a tissue. You should not be treating pain. Pain is a signal. It just exists. It floats around. You got to figure out what tissue is eliciting it and resolve the distress of that tissue. Well, what's the best way to identify the tissue? We just said that every tissue elicits a specific symptom. You know that because the general premise, if you're having pain at your chest and your left arm, if you're having pain at your ankle, you don't say, oh, God, I think I'm having a heart attack. Only if you have pain at your chest and your left arm. So the goal is to interpret the symptoms to identify what tissue's in distress. And whether it's a bone, a muscle, or nerve, each presents symptoms. The holy roller, incredible finding that I can let people know and they have to at some time believe, is that in more than 90% of cases of the roughly 1 billion people worldwide, the 98% of cases, the tissue in distress is a muscle,
Mm-hmm.
and therefore can be in control of resolving the distress of that tissue by understanding which muscles are responsible, understanding how to do the proper exercise, and utilize progressive resistance to get those muscles back to a force output greater than the force requirements of their activities, and they'll be pain-free and fully functional.
How do they get this muscle identified? Is it with
Well,
a therapist, with an ex physio, with a doctor?
unfortunately, for now, it's me. I don't. I need people to understand that, and that's what's so difficult for me. So I have a doctorate in physical therapy. Um, you have to appreciate that typically physiotherapy is no different than any of the other forms of the medical system. They mostly evolve around the idea of diagnosis coming from X-ray and MRI. And even if the physical therapist, the physiotherapist has the ability to try to identify muscle, well, you also have to have this tremendous understanding of how to strengthen specific muscles, individual muscles, and apply the appropriate resistance, which affords a certain understanding of strength training, which, as far as I know, doesn't really fall under the guides of a physical therapy or physiotherapy's curriculum. That's why this really is so isolated.
Hmm.
Um,
So, if you identify the muscle and strengthen the muscle, that's going to resolve the pain.
Not just resolve the pain. What I want people to understand is ask the average person, do they associate symptoms with some level of dysfunction? I get my pain when I walk, I stand, I bend, I twist. I reach behind me if I sit too long, if I'm at my computer. You'll notice that they describe their symptoms as being associated with dysfunction. That in itself should be an instantaneous red flag that the tissue in distress is muscle. Because what allows you to perform kidney, your liver, or your spleen, it's muscle.
Hmm.
And when you notice that if it happens as a result of function, and then when you rest or stop the activity, the pain diminishes or goes away, it should be sirens going off. This is muscle. So the essence of identifying the appropriate muscle, strengthening it appropriately, not only resolves symptoms, it returns the person to full functional capacity, which is ultimately what the person is seeking, not just a resolution of symptom. Because I could lay you on a couch and tie you down for a year. I assure you, you will have no symptoms, but you also won't have any quality of life. You need to both resolve symptom and achieve full functional capacity. The outcome measure for the Yass method is, does the person return to a level of function, if not higher, prior to when their symptoms began? That's how we measure outcome.
And does this work for tendons too?
So tendons are just the extension of a muscle attaching it to a bone.
Hmm.
So there's a lot of people that might have, I'll give you a classic example, Achilles tendonitis. Let's go first, a real
Yeah.
specific. So someone's having left Achilles tendonitis. They can't walk upstairs. They can barely stand. The pain is in the Achilles tendon. A Yass method evaluation, which typically would be by Zoom, would be where I might have part of my evaluation, might have them be to single leg stand and squat. And I might find, strangely enough, although they're having the symptom on the tendon, they might be shown to be having greater difficulty to single leg stand or squat on the right side. And I might find that their pelvis is higher on the left than the right.
Hmm.
So what that's telling me is it's not enough to say that you have an Achilles tendon. Tendonitis means inflammation. It's not inflamed because there's no swelling, heat, or redness. It's irritated. Why is it irritated? Well, here's going to be my theory. The person's glute med, the muscle that provides balance and stability when you're single leg standing, as when you're walking or going upstairs, is weak on the right side. As it weakened, it caused the left lower back muscle to have to compensate to prevent the pelvis on the left side from falling. So, as a result of that, that muscle strains. So they walk with the left side of their pelvis higher than the right. The right foot down and they go to take the step on the left side, the distance the left foot has to travel to the ground is greater
Hmm.
because the hip is higher.
Hmm.
So it's going to come down with a greater force load once it hits the floor. Now the person has to push off that left foot to extend themselves, their left foot forward to take that next step. What muscle takes that step, pushes off? The calf muscle. So the calf muscle is being forced to take an excessive load on the left side because the right hip is weak. And as a result, the muscle strained and is creating pain at the left Achilles tendon. So how do you fix that? You don't
The
address
right
the
glute
tendon.
muscle.
That is correct. You would be
Yeah.
doing hip abduction on the right. Amazingly, I wouldn't even touch that left leg. I'd be doing strengthening on the right leg. I bet you 2 to 3 weeks, that person's left Achilles tendon pain is gone. But you'll only know that if you see the person as a whole and you
Mm.
try to evaluate them from a functional position.
Fantastic. But you're telling me this is not how commonly physical therapies deal with patient symptoms.
So I'm in the United States. I can't account for Australia, but I can tell you now that in the United States, the typical physical therapist is to from a referring physician, which is typically going to be an orthopedist or a neurologist. They're always going to be referred with a diagnosis. They have to be able to bill based on a diagnosis. The diagnosis is derived from the referring physician, typically through an X-ray or MRI. So they're going to be basically being told the person has a structural stenosis, arthritis, meniscal tear, pinched nerve, rotator cuff tear, labral tear, any of that type of stuff, compression fracture, and they're referred for physical therapy. Well, that becomes very confusing because what is the physical therapist supposed to do to correct the structural variation, which is based on the referring physician's diagnosis? Nothing. So then what's the point? There really isn't a point, and that's why the person usually does.
Okay. Wow, this is really interesting. Now let's try something on the elbow. Say someone has tennis elbow.
Ah, good. Yes. Okay, let's talk about any. I'm gonna really blow this up even better. You ready for
Yeah.
this one? This is gonna blow people's
Yeah.
minds. Tennis elbow, golfer's elbow, carpal tunnel syndrome, trigger finger. Any one of those diagnoses I have established is the result. Here it comes. When you look at the purpose of the hand is to grab objects and manipulate objects,
Hmm.
not support the weight of the object, okay? The support of the object and the support of the arm comes from the shoulder and shoulder blade musculature. So what I have established is when someone has tennis elbow, golfer's elbow, carpal tunnel syndrome, any type of trigger finger, any of this type of stuff, what's going on is that they have weakness of the shoulder and shoulder blade musculature, and these muscles are being forced to grab the object a little bit more than they're used to because they're not the object is having being difficultly supported by the shoulder and shoulder blade. So muscles that were designed to just do grabbing and manipulating are now supporting. It's an activity they weren't designed to do. So they strain
Oh,
and
okay.
create pain. So in a case like that, I hate to tell you, the substantial amount of strengthening I do is at the shoulder and I can get them. I mean, with the Yass method Zoom session, you better see a massive reduction in symptom that first session. If I'm right, it's muscular, and I've identified the appropriate muscles, and you do the appropriate strengthening exercise with the appropriate resistance, you better see a change because we're changing forces.
So
The
if someone is
forces,
having, I want to just
yeah,
go through a consult like this with you, Dr. Yes, how it's done in Zoom. So they
yes,
have come and they've tell you there's a elbow pain.
yes,
How are you identifying the muscle via Zoom and how are you giving the exercises? If you can just stimulate how a consult goes, that'll
sure.
also give me,
Okay, so let's say someone says they're having tennis elbow, and
yeah.
again, this is the part that I don't understand why this isn't a critical part for somebody. Shouldn't the first question be, could you point to where your pain is?
Yes.
Because how do you know? No disrespect to anybody, but maybe someone said they have tennis elbow and it's not tennis elbow.
Yeah,
And the
exactly.
person is under the description, under the thought that it, but maybe it's not. So the first thing I do is say point to it. So,
Okay.
they'll probably point to something like right over here.
Hmm.
Now, that, if it's tennis elbow, it's the wrist extensors and finger extensors are strained. So what would you know about if a muscle strained? Typically, it's going to shorten. So I'm going to say, okay, I just want to do a test now. So this is my left side's the one. So I'm going to say, I want you to straighten your elbow, close your fingers, and pull this down. And this is going to stretch the wrist and finger extensors. Then I'm going to say, let me see you try to very, very slowly. Let me try to do it. they might say, I can't even begin to close my fingers. I'm feeling the
Okay.
pain and pull already. So I have flexibility. Number one is the indicator. Then, when it comes to the shoulder on that particular side, they might be standing, and they're standing, and I'll say, okay, let me see. And you notice now, right now, my left shoulder's higher, right? So
Hmm.
what does that tell you? Well, posture is the culmination of the pulls of muscles. So if there's a muscular deficit, there's a high possibility that there's going to be a postural deficit, a movement pattern deficit, right? So I'm noticing that there's a different like that. Well, if I see that right off the bat, I can tell you that the muscles in the upper trap region are stronger than the lower trap, or else they wouldn't have shortened. So
Hmm.
already I know I have to strengthen their lower trap to stabilize the shoulder blade and that type of stuff, right? Then I'll have them now raise their arms. And you might find this happening where the whole
Okay.
shoulder is
It's
going up and down, right? So I'm looking at movement. I might say, put your hands behind your back. And they might not even be able to get the left hand behind the back. Well, that's a sign that the rotator cuff has strained and shortened so severely that it's lost internal rotation. So if you notice, I've just given you a lot of information that I
mm-hmm.
didn't need to touch that person, but I could deduce by knowing so much about how individual muscles affect movement and posture. And that's what I've done. I've cataloged all this stuff in my brain over 28 years. So, from all of what I've said, I would give this narrative. You have tennis elbow because of the fact that these particular muscles, maybe the infraspinatus rotator cuff muscle, your rhomboids and mid traps, maybe even the long head of the tricep, are not holding the shoulder blade against the rib cage effectively, which limits the ability of the arm and any object that is hold to be properly supported, which is causing these muscles, the wrist and forearm muscles, to have to work harder, and that's why it's strained. So again, although the symptom is here, where's the cause? Here.
It's in the
What is a Yass method philosophy? In more than 99.99999% of cases, the cause of pain is not where it's being experienced.
wow. And then you give them the exercises to work
Oh,
on it. So
yes.
that's like something they get. Do you teach them during that session, or they
So,
get some
yeah,
like
yes.
like handouts to do
No,
things?
no, I don't. No handout crap.
No
I don't. That's
handouts. Okay.
that's insanity stuff. These exercises. Here's Yass method understanding of exercise. Every muscle moves one joint in one direction. That's how muscles work. A bicep does elbow flexion, tricep does elbow extension, right?
Extension.
So, for them to isolate an individual muscle, they must be doing an exercise in which only one joint is moving in one direction. That's how I know they're getting the muscle I want. The rest of the body has to be stabilized. So the vast majority of my exercises are in a sitting position, especially if you're doing upper body stuff. So let's say I wanted to strengthen the upper trap. Well, you got to know a lot of detail about how this muscle works. And so they'd have to be sitting down. You have to have your arm 45 degrees angle out to the side. You have to start with your hand over eye level because at that point you don't need a rotator cuff to bring the arm bone down as you're trying to raise your arm. Now you have to only bring your arm up to a certain point. And if you notice, it's one plane, right? And then
Oh.
they'd be holding the resistance. Then I have to teach them what is the proper resistance. How do you determine that? Through something called the perceived exertion scale. So, and by the way, these sessions are all videotaped. Every session is
Oh.
videotaped. So at the end of the session, the next day, I send them an email through WeTransfer, and they get this videotape. And they're going to use that. Typically, exercises performed 3 days a week for 4 weeks. They're going to use the video to make sure they're doing it correctly. At the end of the fourth week, we do a follow-up session. I'm checking, making right direction. They're going to do the exercise for me again. They're going to make sure they're doing the resistance correct to make sure that they're getting the optimal benefit from the exercise and reaching their goals in the optimal time. That next video becomes the new video that they get, and that becomes the supervision for the next 4 weeks. And it progresses until they've gained enough strength in all the appropriate muscles until they're literally going to tell me, I have no more symptoms and I'm doing everything I want.
How long do the sessions last?
Usually at least an hour and a half to 2 hours.
Wow. Okay.
And the answer, you have to understand, I'm crazy. I am one. I believe that I have been given an understanding, and I mean it can get very in depth and complex, especially not just in the diagnostics part, but in terms of how to perform strengthening understanding fulcrum arms and stabilization versus creating all this stuff. Um, I want results. And that
Mm-hmm.
person will not leave that first result unless they finish off telling me that there is a massive change in symptom and improvement in function. And we will see it. So, for instance, one of the tests we do is have them single leg stand on one leg and then single leg squat. And if there's deficit there, that tells me that there's weakness. Well, at the end of the session, single leg stand and single leg squat again, and it better be substantially easier with a lot less pain. That's how you leave off knowing I changed something. Most
Mm-hmm.
likely, I have identified the true tissue in distress and have changed it in a way that has reduced your symptom and improved your function.
Wow, that's fantastic. So I've got two questions that's come up to my mind now. Now,
Yeah.
what is your thoughts on acupuncture helping with pain?
Okay. So it's not my opinion. I don't have opinions. I do everything based on fact. What is pain? Pain is an indication of a tissue in distress. To resolve the stress of the tissue, you have to perform an intervention to the tissue eliciting the pain. So I would just retort back to you, what is the tissue that's in distress that acupuncture is working on? What exactly is that doing to, and by the way, how did you identify the tissue in distress? What's the mechanism of diagnostics that was used? And the answer is no diagnostics we used, and you haven't identified the tissue. You're sticking needles in a area, right? So I can't answer that. My answer is answer my questions. What is the tissue in distress,
Mm-hmm.
and how did you identify that? And if you haven't identified a tissue, and you're not treating it, then you're just spitting up on a wall and hoping it's
Mm-hmm.
if you think it's going to work or not. I don't think that's how science was designed. I am a true old style science guy. I say you will see has a scientific basis behind it. Understanding the concept of theory, hypothesis, and null hypothesis. Understanding that a diagnosis can only be a legitimate diagnosis if you've identified a tissue and the symptoms being experienced by that person are the same exact symptoms that would be created if the tissue identified were in distress. How could you go anywhere beyond doing the diagnostics unless you could tell me that's what you found? You've named the tissue,
Mm.
and that tissue creates the symptoms that that person's experiencing. Without that, what are you doing? Where are we going with this?
So there's also no real reason for pain medication then.
You know it. So here's a concept. I'll give you another one. Again, listen to the logic. When does pain begin? Pain begins at the initiation of distress. It's at the tissue starts to go bad. It's not going well, and it's saying, "Please, I need help right now. Please, I want to let you know it's me." So I'm going to elicit my specific symptom, right? So pain always begins. Doesn't it begin 6 months before or 6 months after? Right at the inception of distress of the tissue. So if you know that's true, and you go to a proper diagnostician who can properly identify whatever that tissue is, provide the intervention so that it's no longer in distress, which will stop its need to elicit the signal of pain, when should pain end? In the acute stage, obviously. So why is there chronic pain globally? That's easy. Misdiagnosis. You're treating the wrong tissue. Whatever you would is the tissue in distress. Clearly it ain't because you're still having the same symptom. So how could that be the tissue? If you'd fix the tissue, it wouldn't be creating symptoms, right? So clearly another tissue, the original tissue, is still in distress. And most likely it's muscle. Why? Because do any muscular causes, whether it's a muscle straining, a muscle causing misalignment of joint surfaces, a muscle referring a symptom, a muscle straining and impinging on a nerve that refers a symptom, does any of that show up on diagnostic testing? Nope. So how are you going to identify that? That's why there is a global crisis. And for some reason, God has bestowed this lovely understanding on me. And I simply believe my job is to get it out to as many people. And again, I tell everybody, don't listen to me. Don't accept it because I say it. Listen to the words. Listen to the words. If they're logical, if they make sense, how could you deny it and how could you go against it?
Hmm, interesting. Now, how long does a person, once they start therapy, I know different people can differ and depends on the severity of their symptoms, how long soon can they see benefit?
Well, as I said, they better see benefit the first session. Irrefutably, they're going to see because it's the only way I can confirm to them that I have in fact identified the right tissue and have provided an intervention to begin to cause it to no longer elicit symptoms. But for them to create enough strength to where all the muscles required for activity, the force output of those muscles is greater than the force requirements of their activities, you're looking at 2 to 3 months, right? But remember that you're only seeing me as the practitioner, if you want to call me that, once. If you have a strength deficit, who's going to make you stronger? Can I actually make you grow muscle mass? No, only the
No.
person can. So what you need is the appropriate guidance. You got to make sure you get the right diagnosis. You got to make sure you know what's muscle. You know how to do the right exercise. You know how to progress resistance. After that, now it's up to you. And this is where I think a lot of people remain in pain. A lot of it is because they've just been misoriented towards what the cause of their pain is, and in this unfortunate abyss that muscular causes to be identified. But a lot of people sense within themselves that they might have a muscular deficit. Well, if you're willing to accept that, then you're going to have to also accept only you
Can
can
fix it.
resolve your core, right? Can only fix it, and that means you're going to have to commit to it, and you're going to have to do it, and you're going to have to concentrate. And the good news for me, at least, is that I'm telling you, you don't have to do this 7 days a week, 5 days a week. It's 3 days a week, and typically it's no more than 3 to 4 exercises. It's about an hour, 45 minutes to an hour to do the exercises, usually for most people, and that's 3 days a week. And the good news is that I'm going to ask you to continue to progress your resistances until you are asymptomatic and fully functional. But once you get there, you don't have to progress your resistances anymore. Developed enough force output in all your muscles for your activity. You just sustain. So I'm asking you, just like brushing your teeth, combing your hair, taking your shower, I'm telling you, perceive doing your exercise 3 times a week as a part of a lifestyle.
Mm.
It has to begin to become that. It can't be a burden. Nobody's going to sustain a burden. But all I can tell you is it's this or pain and dysfunction. You get to make your choice. I could just profess it. I go there to every person and stand over you. That's not going to happen.
Now, there are a lot of type of exercises in the world currently. Do you think there's one better than the other for somebody who wants to maintain good health?
All right. So here's the concept. So whether we're talking about Pilates, treadmills, jazzercise, aquatherapy, I want everybody to perceive it this way. If they're within that activity you're doing, you are using groups of muscles, that must be considered an activity. Okay? And what that means is that that activity is being done by multiple muscles. So if you have a weak muscle, you're not going to be able to identify it within the activity. And in fact, your brain is going to actually alter how you do the activity to compensate for that weakness. So it's going to get other muscles to try to do that activity, which potentially can lead to pain.
Hmm.
Okay? So if you have a weakness or an imbalance, activity based exercise can never help you with that. The only thing is identifying the appropriate weakness or imbalance and performing isolated strength training. What I promote, the use of one joint moving in one direction to isolate an individual muscle so that individual muscle can have the appropriate resistance applied to it so that all your muscles could be strong and balanced to allow you to perform your functional activities without compensation and without symptoms. So my preposition is that isolated strength training is the basis for all activity. I'm never going to tell anyone you shouldn't bodies, golf, tennis. You do anything you want, but you just have to understand you must be conditioned for it. And it's in the same premise of does anyone have a problem with a fireman conditioning themselves? conditioning themselves, a policeman conditioning yourself. Well, why, if you're an IT person and you're using a computer with your hands, why shouldn't you condition your shoulders down because you're going to be using those arms 8 to 10 hours a day? Why do you think you're different? You think you're magically going to sustain strength just by will? You want it to happen? If the activity requires more strength than you have, you got to condition yourself. So anyone doing any activity that is sustained, regardless of how sitting for a sustained period of time, you better strengthen your butt, your hamstring muscles to stop the tendency of pulling forward to where you shorten your hip flexors and quads, which pull excessively on the back and lead to back pain. If I was going to sit for long periods of time, I'd make sure I'm doing some exercise to strengthen my butt and my hamstrings. And that's going to allow me to sit as long as I want. It's a sustained activity. Condition yourself.
Now, another question just popped up to my mind. Now, for all
Yeah.
of those of us who are in office-based job, desk-based, and there's a lot of people presenting nowadays with upper back pain, shoulder, tight trapezius, things like that. What is the muscle involved that they can actually work on to get relief?
The number one muscle, for anyone watching, hopefully you can see this.
Yeah.
The number one muscle responsible for headaches, neck pain, and shoulder pain is a weak lower trapezius muscle. It's this muscle right here. Most people know of the upper trap, which is the muscle that runs from the shoulder blade to the top to the skull, right? And what happens is that if you are doing a lot of activity in front of you, you'll find that your head is positioned in front of your cervical spine. So it's no longer being supported by the cervical spine. You have created a load. And that load has to be picked up by muscles in the upper back. Now, if that load is sustained, these muscles which are supporting it can strain and actually can shorten pulling your shoulders up. And so a lot of people who have neck pain, you'll kind of see this upper shoulder posture, right? Even with the people having the headaches, the migraine headaches, stuff like that. Many
Yeah.
of them are tension based. So how can we stop this sense of the head being pulled forward and the shoulders being pulled up? Well, it would be nice if something can pull the shoulder blade down the back. Well, if you look at the lower trapezius muscle, it attaches from it's called the spine of the scapula. It's this big bony protuberance on your shoulder blade. And the muscle runs all the way down the thoracic spine, all the way to the bottom of the rib cage. It has a leverage arm. It has a huge ability to create force. So if we were to strengthen this and it was stabilized on this side, it would mean it would pull your shoulder blade down your back. Well, think about if your head is connected to your shoulder blade via this muscle and this gets pulled down your back, that's going to pull your head back. And it will sustain the proper posture, thereby ending migraine headaches, neck pain, and shoulder pain, or pain between the shoulder blades. So if there's one most significant muscle that is completely underutilized, under-recognized as a primary cause, it's the lower trapezius muscle.
And how do you strengthen that? Are there
So
specific exercises?
and that's another thing is that a lot of people want to think that there's lots of exercises to do for any particular muscle. That's insane because what did we just say? Every muscle moves one joint in one direction. So how much variation can you have in an exercise? So if I want to do biceps, I could do bicep curl. If I want to do triceps, I could do tricep extension. If I want to do my deltas, the idea of varying it for the sake of varying it is foolhardy. I'm trying to get that muscle to adapt to the greatest resistance during the exercise to cause it to adapt and get stronger. So the exercise for the lower trap exercise was the one I was showing you before, where the arm is off 45-degree angle to the side, your hand is at eye level, you're holding a resistance band that's attached to the chair or a dumbbell if you have, and you're just raising your arm towards your ear until the upper arm is in line with your cheek. This motion right here is actually causing, if you were leaning back enough, you would feel your shoulder blade going down the back. So what's happening is the shoulder blade is being pulled down the back. That's what's causing my arm to rise. I'm not using my deltoid. I'm actually using the lower trap to pull my shoulder blade down my back, and that's what strengthens it. Now, if you've done the exercise correctly, amazingly, and I people, I'll say stand up, and that shoulder looks like this. It's much lower than this after the exercise. I have shown them that they achieved shoulder blade depression, which was the key we were looking for. And in fact, what else did you just learn? That posture is the culmination of the pulls of muscles. So they changed their posture, the shoulders lower, and they showed that they, in fact, isolated the lower trapezius muscle.
Wow, fantastic. Dr. Yes, it's been really, really informative.
I
And
love this stuff. I love teaching it.
yeah, yeah, and relearning what you've learned. Okay, so I think we're coming to the end of it. I wish we could just keep going. I'm learning a lot. Now, can you give us your top three advice for our listeners today?
Yes. And it's hard, and I understand it's hard. But the point I want to try to make to people is if you've been being treated for a sustained period of time and you're still having your pain, can you please be open to the idea that maybe the person treating you just doesn't know what they don't know? It's not a sign of disrespect. It's not a question of character. It's simply the fact that maybe they just identify the tissue in distress. That's your symptom because, quite simply, that tissue may fall out of their scope of understanding in education. So please be open to that. Number two, if you associate your symptoms to an activity, your pain comes on if you sit too long, stand too long, kneel, reach, anything like that, and then it's limited by resting, you must accept the fact that your problem's muscular. You just have to. And then, finally, if it is in fact muscular, and this is the hard part, you got to find someone like me who could just give you the basis of understanding as to determining which of the muscles involved, show you how to do the proper exercise, how to use progressive resistance, and then you're on your way to ending your pain. I don't know how to explain it any more than I've shown that in more than 98% of cases, the cause is muscle. And until you're willing to free yourself to that belief, you're kind of stuck in this quandary, this world of, we keep doing treatments, we giving you masking agents, and nothing's working, and time's passing, and you're losing. They're not losing quality of life. They're not becoming, depressed and hopeless and anxious and frustrated. You are. And so you need to take that energy and direct it in a different direction. And my opinion is just believe that there's a chance. And here are the indicators that it's muscle. And if you do come to that conclusion, be empowered, be excited. Muscular problems are very, very easy to solve. You just have to know which muscles and how to strengthen them. And you could then, once you find that out and resolve your symptoms and improve your functionality, prevent it from ever reoccurring. Think how empowering that is for you. So that's my wishes for everybody.
Great. And is there anything you've read or listened that's really inspired you that you'd like to share with us?
The thing that has inspired me through this entire 28-year, uh, odyssey is really the guy who I look up to more than anyone else in history, and that's George Washington. And the reason it's George Washington is because his entire early aspect of his life, he was a massive, massive failure. He failed as a British Army guy. He kind of got a lot of what he got through marriage. Even in his initial stage as the head of the Continental Army of the United States, he was failed. They even considered replacing him. But the man had fortitude. The man believed. He believed in providence. He thought he was power and that whatever had to be done, that he would be given the ability to achieve it. And he stayed in the process, won the revolution, became the president, the country to be developed. And you got to give kudos to a guy who, after failure, says, matter to me. I think that I'm supposed to be doing this for something that I just don't understand in the future. And that's where I find myself. I don't know why I'm doing it. I don't know why I was given this information. I don't know why I've been told to do these podcasts and stuff. So I'm just doing what I think. And when the end is shown to me, I'll know why I was there. So that's primarily why I feel such a strong connection to George Washington.
Nice, nice. That's, yeah, definitely very inspiring. Now, I think we've come to the end of this show. So before we go, where can our listeners find you?
So the easiest way with me is through my website, which is livewithoutpains.com. It's plural. Livewithoutpains.com. You'll learn about me and my method. And if you decide you want to schedule a Zoom session, you could do that there. And then if you want to contact me by email, it's drmitch@mitchellyass.com. Those are the two easiest ways to get in touch with me.
Thank you, Dr. Yes. So thanks for coming today and giving and very fiery information. I mean, it's really fun talking to you.
Uh,
And I learned a lot. So thanks for coming and thanks for sharing all that information with us today.
thanks for having me. I appreciate it. And I'm happy to come back anytime you ask. I'm always willing
Thank
to
you.
spread the gospel.